COVID-19. But actually, as you showed us last week, we said this was everybody's business, and you proved that. Many of the people who pledged actually weren't businesses, old, young, everybody did. And of course, business did as well. But of course, the idea came from business. And so throughout the evening, we will be appealing to you to actually give and give generously. One of my colleagues said that when I came on, I should say no amount is too small. Well, actually, I'm going to say no amount is too big. So please give whatever you want to give, and don't feel there's any ceiling or any restriction. And throughout the evening, I'll be joined by guests to my left and my right, who will be giving some context to what we're doing and why we're doing it. And so let me first of all introduce the first of my two guests this evening, who will be helping us on this telethon to raise money in the fight against COVID-19 or coronavirus, whichever you prefer. To my immediate left is Sarata Konate, who is the Deputy CEO of the GCCI, the Gambia Chamber of Commerce and Industry. And of course, they are the ones who came up with the idea. Welcome to the program, Sarata.
Thank you. Thank you, Adi. Hello and good evening, viewers.
And before I introduce my next guest, don't be shy about asking questions in local language. Throughout the evening, some of my guests can speak, other than myself, who can only speak English, Creole, and very bad Portuguese. To my right, I have Dr. Ismaila Badji, who will be giving us some of the medical context to what we're talking about today. Ismaila, welcome to the program.
Thank you for having me. Pleasure being here, especially for a cause like this. So it's great to be here.
Thank you for taking your time to join us.
Absolutely.
And now, when I mentioned this last week, you'll see me with lots of papers. There are lots of facts and figures, and it's not that we're trying to scare anybody, but we're just trying to make you realize that what is happening and why we're talking about this, it is real. So all the myths about this is not affecting black people, it's a nonsense. Various black people have died, including today a legendary musician from Cameroon, Manu Dibango. Those of you who know the song Sol Makossa will remember him. This man was a giant of African music, made music for over 50 years. He died in Paris, but he's an African. And so please, don't believe the myths. And Dr. Badji, to my right, will be giving us some of the context. Now, I was also asked what's happening with the money. Well, we'll have about maybe 10 guests or so who will tell you what will be happening with the money. And also, you can belong to any bank, because of course the GCCI, which came up with this idea, has accounts with every single bank in the land. So you don't need to worry about that. But most of all, this is about supporting the government's one-year plan that they've set out for fighting this disease. And I mentioned last week that one of the reasons is if we ever get to the stage where there's a lockdown, 87% of the people in this country are paid cash in hand a lot of the time. And so if people have to get money and they can't, they need help. And that's part of what this is about. But as I say, throughout the evening, you will hear what the rest of the money will be spent on. But I think I must start with Sarata, because GCCI are the ones who came up with the idea. Somebody might ask, what's the GCCI? And what's it your business? If they were being facetious.
Thank you. Thank you again, Ade. Very important question. We are a membership organization first and foremost, and that's very important for everybody to remember. We are owned by the businesses and individuals that have come together to be part of a network, and that's who we are. It's a 53-year-old network and has been with so many legacies over the years. But we decided to come out with the support and very important initiative for three important objectives. The first one being to raise money to support the government's plan that you've just mentioned, which I will talk a little bit about further on. The second was, again, first and foremost, we are citizens also first, and everybody must remember this. Before businesses, we are citizens of this country, and we all are in it together. So we needed to come together to show that we can raise this. We cannot leave government to do this alone. We should not wait to be told what we should do and what we can do. The third objective, Ade, which is what I am even more proud of, was that this initiative really has been the one and key initiative that has made responsibility go viral.
Sure.
I was touched, honestly, on Saturday after the first telethon on Thursday, when taxi drivers personally came in to GCCI to donate 300 other individuals that we had set out for. And in order to explain more about the plan, the bulk of the support that government has outlined will really go towards case management.
Sure.
If we actually do have the confirmed cases in huge numbers, God forbid, the bulk of the money will go towards that. Also, a big amount of the money will also go towards logistics and safety support as well. But interestingly, there's also money identified for psychosocial care and support as well, for even after the aftermath of Corona, which is also something very important that I'm sure Dr. Baji will also talk about.
Sure. Okay, let me come, as you've mentioned it, a nice segue to you, Dr. Baji. When I was speaking on last week's program, I said every now and then a word comes along and you wish you'd never heard the word. As a Sierra Leonean, for me, it was Ebola. It was Ebola. And now it's coronavirus. I wonder if you could just, for the viewers' sake, break down what coronavirus is. All of us, we think we're experts all of a sudden, but you as a medical man must be able to. Can you please break it down for us?
Yeah, absolutely. And I always, once again, I commend GCCI for the initiative. But I always want to start by saying, especially when it comes to coronavirus, nobody's an expert. The thing about viruses, when it happens, the whole medical community starts chasing the virus to understand it. So information changes day by day. But the good thing about this coronavirus is, one, the word coronavirus, it belongs to a group of viruses, right? Corona means crown.
Yes.
And the viruses have crown-like features like the visual.
Sure.
So at least maybe what helped the medical community is, a couple of years ago we had the Middle Eastern, like respiratory syndrome,
that's right.
MERS, right?
Yeah.
And then SARS came,
Sure.
which was the severe acute respiratory disease syndrome.
Sure.
So at least it gave us an idea once this whole outbreak of pneumonia happened in Wuhan, China,
Sure.
when they identified the new coronavirus, like, okay, these are the things we know about the virus,
Sure.
right? It spread through droplets.
Yes, indeed. Yes.
So, which is why a key visual for the people watching too, we're all sitting at least a meter apart. So if I was to cough
Sure.
and it landed on your face where your mouth, your nose, your eyes are exposed, I could transfer it to you.
Indeed.
Meaning from a disease standpoint, it's considered a communicable disease.
Sure.
Because being close to somebody can give you the
can get
disease.
that. Sure.
Likewise, the nature of the droplets, if I coughed into my hands and touched a bottle of water,
Sure.
and hand you the bottle of water, you touch the same contaminated bottle of water and rub your eyes,
Sure.
or pick your nose, that's also a means of transferring the disease,
Sure.
which is scary. And the disease, what made it really, really scary for the medical community is most times when you have a disease, it's a couple of days you start feeling ill.
Sure.
But what we've seen about the virus so far is you could go from 2 days to 14 days without showing any symptoms at all.
Sure.
So I could presently be infected and be perfectly fine,
Yeah.
but if it's a room of 10 people,
Yeah.
even if it's 3 people that I infect, then the multiplying effect starts happening.
Of course.
So by the time I get, let's say, sick on day 10,
Sure.
how many individuals have I been exposed to,
Sure. Sure.
right? So at least what we know so far, about 80% of the cases, at least a high number will recover.
Right.
But where the health system comes into play, which you hear the term flattening the curve,
Yeah. Yeah.
right? Social distancing.
Sure.
All that means is we know health systems cannot handle a large population of people getting sick at the same time.
Indeed. Yeah.
So when it happened for me, like anything else, if it's bad in places where they have systems in place,
Sure.
it could be worse for places where there's not.
No. Yeah.
Right?
Indeed.
So then it's like, okay, as a community, we all have to get up and one, respect the virus,
Sure.
but also know that our health systems are not designed So the only thing we can control is limiting exposure, which distancing from people.
Indeed, yeah.
But every single day we're learning new things about the virus. People are finding out that people who have pre-existing conditions like
Are more
diabetes,
susceptible to-
hypertension,
Sure.
smokers.
Sure.
And when I say smokers, I tell people, a lot of times people think cigarettes, but even shisha smoking
Right.
increases your risk of severe illness because it's considered smoking,
Sure,
sometimes actually worse than cigarette smoking.
Okay.
So now you bring a younger demographic who may feel like, well,
It's not.
I'm kind
It's
of
not my.
exactly. It's not
Because
my
I was going
disease.
to ask you about that. People keep saying it's an old people's
No.
disease, and old people are the ones who are more likely. But you've just touched on that point.
Not at all. And what I tell people is when we wake up every day, it's not like we get a number of where our immune system is.
Yeah.
You don't wake up and you stand in the mirror. Maybe in the future, that might be
Possibly,
science
yeah,
where
right.
you're like, okay, my immune system is at 10%. But you could be a young individual, but your immune system could be suppressed
Sure.
due to lack of sleep, certain medications that you may be taking, your diet, so many factors
Sure.
where that contact could happen when your body's not ready to fight, and then it could get a little bit severe. So it's
Sure.
something everybody should respect.
Sure. Well, thank you for that. And talking about saying this is something that everybody should respect. Well, our neighboring country, Senegal, which embraces the Gambia, just before we came on air, I thought, let me check what the figures are. And they've had 86 cases in Senegal that have tested positive. And here in the Gambia, of course, we've had one death. And throughout the evening, as I say, we're not trying to scare anybody. We're just trying to bring it home to you as to how real this is. But also, most importantly, throughout the evening, we'll be having a numbers on the screen that you can call to make your pledges. And so when those numbers appear on the screen, please call in. And we want as many people as possible to get in touch. So when the numbers appear on the screen, use those numbers and call in. And also, just quickly say what your name is, how much you're pledging. And so that will allow us to have many, many more people to call in and pledge. So, I know. So let me just give a quick breakdown. And this is from the situation report, which the Ministry of Health issues every day. They've issued 5 as of up to the 23rd of March. And it says 1 laboratory case, new case recorded. Cumulatively, the country has now a total of 3 COVID-19 cases. All were imported, and there was no link between the 3. And the first person who was initially hospitalized, they said is recovering well. And they go on to give the global figure, and we'll mention something about the global figure. But in the case of the first patient who was identified as positive, she was a 28-year-old Gambian female who arrived in London on the 15th of March, and she reported for laboratory test at the MRC labs on the 16th of March. Now, the second case is the person who unfortunately passed away, and he is a 70-year-old male, Bangladeshi national. He arrived in the Gambia with 3 other nationals, and it's important to say this because people might be able to actually know what the initial, how the person came and who they came with. And so he arrived with 3 other Bangladeshi nationals on Air Peace Airline on the 14th of March. And on board were a total of 25 passengers, 4 Bangladeshis, 2 Gambians, and 19 Nigerians who were all on board that flight. And they started from Bangladesh, and they passed through Thailand, Ethiopia, Malawi, Mali, and Senegal before reaching the Gambia. And they were picked up at the airport by 2 vehicles. The person was resident at Bundung Markaz, and this was a closely tight-knit religious community, and the person stayed there since his arrival. And he first reported at the OPD at Bundung with mild symptoms, and that was on the 19th, so 5 days after he arrived. Then the person was reported back on the following day, the 20th, with severe, what were described as pneumonia-like symptoms. And the person was then, we are told, given some help and was being transported actually to hospital, but died before reaching hospital. And that person had come into contact with several people, and all of those people, they're now trying to trace them. And we will keep giving you the number if you think somebody might have been on that flight who has not been contacted yet. The number is a toll-free number. It's free to call. It's 1025. 1025 is the number to call. And so please call that number. The number is on your screen. The number is on your screen, 1025. And so far, they have received 453 calls. And they have 875 calls relating to symptoms and prevention, and in fact 3 people have called them to self-report because they felt they had it, and 128 of the calls were not related to COVID-19, and 37 of the calls that came in were then referred to go and get tested. So please, if you feel either you have the symptoms or somebody has it, or you think somebody has traveled on a flight with somebody who has the symptoms, or as unfortunately happened with this gentleman, has died, please do not hesitate to call that number. It's toll free. It's free to call 1025. It's on the screen. So please, those are some of the things. Sarata, if I can come back to you. We started with GCCI, and we said, this is everybody's business. And you mentioned the 3 things that you would like to see. Somebody, again, one of my colleagues were discussing this, he sort of said, what are you expecting in terms of donations? I said, I'm not putting a ceiling, which is why I said no amount is too high. Right. But not an amount, but what sorts of things would you like to see have happened by the end of the night, really?
Because you've already said no amount is too high, I'm still hoping that we can reach the 20 million, which is what we first declared when we came on air on Thursday. I do not, without any doubt, feel that it's far-fetched. I was overwhelmingly surprised by the first telethon that we did. I didn't think we would get to the 2 million, which we did. So I think we can still get there, and if we do not today, we will still urge our businesses out there, our individuals, to come and continue to support and donate. I think it's an important cause. Another objective that I could not perhaps dilate on when I first started was to intensify this awareness creation, really, which is what, again, we also set out to do. In addition to this telethon, which is what we felt would be the fastest to be able to go viral, we have also set up a GoFundMe account in the diaspora, and I'm sure some of the panelists will come after me, after myself and Ismaila, to speak more on that. And then the account numbers and links will be also provided on the screen later on. But also we've developed pamphlets and electronic newsletters to share how businesses in their day-to-day activities can help and protect themselves and their employees as well. And it's available on our website, on our web pages, on our Facebook pages. So those are the sort of things that we were able to do from the onset.
And one thing I must ask before it goes out of my head. In the last 3-4 days, I've seen a lot of businesses have actually put hand washing sort of materials, including buckets,
in their workplaces.
I mean, is that something you communicated to members?
Perhaps, again, once you start with communication, everyone feels the need to take it a step up, or to take it a notch up, because one, they would be more educated. They've gone online also to read more. Their families that are abroad who are more impacted would have communicated so that they can be more cautious and more conscientious of what they could also do to help themselves. So, I mean, we've all contributed. It wasn't just GCCI, I would say. So it's a really surprisingly delightful feeling that we have at the moment, to say that the responses have been really positive and embraced.
I mean, particularly for the fact that telethon new to the Gambia. And so I was really, really pleased. And again, you'll see the figures appearing on the screen as to how much has been raised throughout the evening. And as we go, over 3 million pledged from last week, because people kept pledging even after we went off air. And so, as I said, the figures will appear on the screen, and we'll keep you updated as the night goes on. But Dr. Baji, if I can come back to you. One thing I've noticed is that because when people have been doing all their own research about coronavirus and COVID-19, call it what you will, they see symptoms, and they might have just a cold or just a cough, and they start panicking. I mean, what's the message for people like that?
I think the message, for one, the vigilance is okay.
Yeah.
I think it's to a point where even if I coughed right now, both of you guys will kind of
Like, hey.
Be alert.
Sure.
But it's also good to understand what it's doing to your body. If it's a respiratory disease, it's not the only respiratory disease. You could have a common cold, similar symptoms.
Sure.
You could have a flu, similar symptoms. You could have allergies. Gambia, it's very dusty.
Sure.
So a lot of people suffer from seasonal allergies who are coughing and sneezing.
Sure.
But anytime there's an onset of symptoms, which is why I think people understanding what supportive care means is very important.
Sure.
So there's hallmark things that most likely you'll have a fever
Sure.
if it's the coronavirus.
Sure.
So if you start coughing, you might be alerted. Like, okay, what is this, right? If you start having a fever, then you want to be more vigilant.
Okay.
Right.
My colleague Jennifer is in the call center, and she's going to tell us what's happening. Jennifer,
Sure.
how's everything going? I think calls are coming in.
Exciting.
Jennifer, can you hear me?
Yes, Mr. Ade, calls are coming in. So far, we've had about 30 calls. And I'm currently at the call center. And as you can see, calls are coming in. People are giving in their pledges, which I think is really exciting, because I am happy that you mentioned that no amount is too small, because this is a collective responsibility, because COVID-19 is affecting all of us, and all of us need to come together to put in some money to be able to fight against this. Mbokk yi ñoo seetaan comme ni ma ko waxee ci anglais tey GCCI dañ ñëw fii nii pour ñaan leen ngeen dimbale leen si naka la ñoo mën a fighté Covid-19 so far fii nii am nañ fi 30 nit yi nga xam ne call nañ te man dama kontaan trop bu Mr Ade waxee ne benn amount ndawut loo leen ñu munti jox ñun appreciate nañ ko driver bi mun na moo joxe carpenter bi mun na moo joxe kuy dem school sax mun na moo joxe because lii dafa nekk loo xam ne collective responsibility la Covid-19 benn nit bu mu affect rek dinañu affect ñun ñëpp thank you so much Mr Ade. I was just explaining to our wall of viewers that no amount is small. This is a collective responsibility, and so far we've had 30 callers, and as you can see, the process is very transparent because we have callers, we have people who will be receiving calls and pledges, pending them down as transparent as possible.
Jennifer, thank you for that. Thank you for that, and keep on. And now we're about to open the phone lines. And we want you, as I say, don't be shy, and call in and pledge, and no amount is too small and no amount is too big. And really, that's what this evening is all about. It's not about this being a talk show about COVID.